Hi, my name is Jen. I'm the owner of My Brooklyn Pilates, and I'm almost 24 weeks pregnant with my second child. I know one complaint many of my pregnant clients have had is lower back pain. Now, this is just achy back. Now, if you have anything like really serious or sudden pain or extreme pain, constant pain, nervy pain, something running down your legs, definitely go see your OBGYN or go see your midwife and discuss that with them first. If it's like a little achy lower back, some of these exercises may help. So we're going to do something just short and sweet, 5 exercises today, seated in a chair, that you can do to help relieve some lower back pain. So one common cause for that lower back pain is that growing belly. So as it's going forward, getting heavier, dropping down, it pulls on the lower back, it tips the pelvis forward into what's called an anterior pelvic tilt, and then there's your lower back pain. So a couple things to do. We're going to do a couple breathing exercises. We're going to do some gentle movement, and that's it for today. So seated in a chair, on a stability ball, on a couch, on a bed, whatever's comfy for you, place your hands onto your belly. So the first exercise is belly breathing. So you're going to sit up as tall as you can. Take a breath into your hands and fill your belly with air. And then breathe out through your mouth. So if we can see, I'll turn sideways in a moment so you can see from that angle. But the belly is going forward as you breathe in through your nose. And you're hugging that baby into you as you breathe out through your mouth. You can imagine blowing out candles. Or fogging up a mirror. Or saying, shh. Go with the mouth shape that feels most helpful for you. So turning sideways so you can see that. So again, belly is going forward as you breathe in. And as you breathe out, the navel's drawing back, the waist is cinching in, and that's also strengthening a nice deep abdominal muscle called your transversus abdominis. It helps support your spine, your internal organs, and the growing baby. So exercise number 2 is another breathing exercise. It is called rib cage breathing. It's also known as intercostal breathing or 360-degree breathing. And that's a focus on the inhale. You're focusing rather than on the belly. You're focusing on your rib cage. The exhale is the same. The navel drawing in, the waist cinching in. So a few different places that you can place your hands. One is to place your hands around your rib cage. And on that breath in, feel the rib cage expand. And on your breath out, the navel drawing in, the waist cinching in, trying to grow a little bit taller. Another hand position to try is one hand on your breastbone, one hand palm facing out, just below your bra strap. And you're trying to breathe in equally into both hands. And again, exhale, drawing your navel in, cinching in your waist, growing taller. Another hand position to try is hands on your belly. But after you maybe do one belly breath to get that belly drawing in. And after that, can you keep your belly still and focus on sending air anywhere else but right here. Again, you can play with the mouth shape. Exercise number 3 is going to be some pelvic tilts. So our pelvis naturally, when you're pregnant, likes to tip forward. It kind of pulls on the hip flexors, pulls on the lower back. And we're going to try to get it into a little more neutral position. And so sitting in our chair, you're going to either start in that anterior pelvic tilt where the belly is going forward. You're kind of rocking forward on your sit bones, which is bony points that you sit on the bottom of your pelvis. And then you're going to try to reverse that. Draw your navel in. You're trying to curve the back in the other direction, trying to tuck your tail under ever so slightly. You will notice that anterior pelvic tilt is going to be a lot easier than the posterior pelvic tilt. But we're just trying to get a little movement there in the lower spine. So I'm going to turn sideways so you can see me again. So inhale, I'm kind of shifting forward a little bit, arching my back if that feels comfortable, shifting forward on my sit bones. And then try to shift a little bit back on my sit bones. Try to tuck my tail under just a little bit. And also think those sit bones are wide when you're going into your anterior pelvic tilt. And those sit bones narrow as you tuck your tail under. Again, it's going to be probably a small movement, depending on how far along you are. But even that little tiny movement can feel good. Again, we're sticking with what feels good. Going from your anterior pelvic tilt through your neutral pelvis to your posterior pelvic tilt. Now, can you find a spot that's a little more neutral, that's not too far forward, but somewhere in the middle between those two tilts? And while you're here, can you press one sit bone down into your chair and try to lighten up the other one? And then switch. And both of my feet are firmly planted on the floor, so I'm not picking up my feet to do this. I'm shifting weight into one sit bone and trying to pick up the other one. So the one that's being lifted, that waist is shortening, and the other waist is lengthening. Again, just a little gentle movement of the pelvis. Try to unlock that tight lower back. And then find that spot that's right in the middle again. So again, we're trying to find our neutral pelvis with both sit bones equally weighted into your chair. And we're almost done. We have a couple more stretches to go, a couple more things to do. So number 4 is going to be a little spine stretch forward and an extension back. So ab work, people get nervous. Oh my gosh, I can't do ab work while I'm pregnant. Well, yes, you often, when the belly starts to expand, you get rid of the crunches and the sit-ups and the rollovers and the plows and all of those exercises that are considered weighted flexion. But that doesn't mean you can't bend your spine. You're allowed, and even you can adjust crunches to some extent, modify them quite a bit. I use my wedge pillow, so when I do a crunch, it's on a slight ankle, and it feels nice. It always feels nice. I keep it tiny. So taking out some of the range of motions, making the movement smaller. Again, I said I do mine on my wedge pillow, or if you're holding on to your thighs and doing a little abdominal work. But again, it's gentle. It's just enough to kind of like get those muscles moving a little bit and to get the spine moving. So you can do some bending of the spine, crunches. But another version we're going to do today, it's sitting. So sitting in a chair, sit bones are heavy. We're in our neutral pelvis. We did lots of stuff. Our last little series of exercises were all from the waist down. This is all from the waist up. You're going to place your hands onto the back of your head. Either lace the fingers or one hand on top of the other. Or if you want the hands out by the ears, if that's more comfortable for your shoulders, you're welcome to do that. Your choice. You're going to point the elbows forward. And you have your natural beach ball here. You have a beach ball on your lap. And you're going to stretch over that beach ball. You're going to bring your chin down towards your throat to stretch out the back of your neck. As you exhale, you're going to do a little gentle curl forward, pointing your elbows in the direction of your lap. And then take those elbows, support your head with your hands, and reach the elbows up towards the ceiling. So this is all from the waist up. And the waist down is holding still, because sometimes lower back pain is because the upper back is stiff. So if we get a little range of motion in the upper spine, that can take some out of the work, out of the lower spine. I'm using that same ribcage breathing we were doing earlier. Let's do one more. And then come back to center. One more movement for the upper spine. Open my elbows out so I can see the tips of my elbows in my peripheral vision. I'm going to take one elbow to point in the general direction of the floor and one elbow up towards the ceiling. And then switch. So again, just trying to get a little more freedom in the rib cage. Give it a little gentle pull for some of those tight muscles in the lower back. Again, keep it gentle. Make sure it's always feeling good. And just keep breathing. You can breathe in as you tilt. You can breathe out as you tilt. Whichever feels the best. Or play around with both. All right, last one. Exercise number 5 is a little stretch for our hip flexors. We'll do it right here in our chair. So I'm going to turn sideways. Place one hand on the back of my chair if you have the back of a chair, or put your hand onto the back of your couch. And if you have a stability ball, you may want to get this up against a couch or against a wall or something, because the ball's going to be a little wobbly. So you may want to switch to a chair if you are on a stability ball, just for safety, so you feel a little more secure. So the leg that's closest to the back of your chair is going to stay on the chair. This leg is going to slide back. You get to choose how far it goes. We're going to see if we can keep our body from going into that anterior tilt, trying to keep my neutral. And you go back as far as feels comfortable. Just wiggle the foot back. I give my rear just a little squeeze, trying to stretch out the front of my thigh. You can either do the belly breathing or the rib cage breathing. We want to feel a little gentle stretch along the front of your thigh. My kneecap is aimed down towards the mat. If this bothers your toes, you could also turn the toes under. And then bring that leg forward. Turn around to the other side. So again, the leg that's closest to the back of your chair will stay on the chair, the seat of the chair. The other leg's going to slide back. I'm going to sit up as tall as I can. And find a spot you're like, oh, I feel a little gentle pull in the front of my thigh. Again, toes can be turned either this way or toes can be pointed. And stay there and breathe. And that's it for your 5 exercises for today for lower back pain. I hope it gives you a little bit of relief, and don't forget to subscribe.